Hello, welcome to my channel. My name is Pauline R and the title of my video is Peri-Operative Nursing. Questions and answers taken directly from RN Nclex examination. Please hit the thumbs up button. Please subscribe to my channel. Please share this video with your other classmates. Please. My first question, when does peri-operative begins? The correct answer, from the time the patient enters the facility for the procedure until the time the patient leaves the facility. My next question, who is responsible for the informed consent? Correct answer, the doctor, the surgeon is responsible. The nurse is not responsible. The nurse only witnesses a informed consent. Next question, how would you prepare your patients for surgery the night before? The correct answer, the patient should be NPO, nothing by mouth as ordered by the doctor, no water, no drink, nothing after midnight. Oral care is okay. The patient should not swallow any water. The patient is NPO. Doctors may order enemas or cleansing enemas for patient. For example, patient may be going down for colonoscopy. Then it's the nurse's responsibility to complete the patient's chart for getting the patient ready for surgery. Make sure the night before a completed EKG with the results should be in the patient's chart. The patient's history and physical should be in the patient's chart. The lab values should be in the patient's chart the night before, or there are some early lab values early in the morning before surgery. Make sure the lab result is completed before surgery. Notify the doctor of any abnormal lab values. Notify the doctor of any abnormal vital signs. Notify the doctor of any abnormal glucose for your diabetic patient. If it's too low in the mornings, the patient have not eaten since midnight, make sure there's a dextrose 50 syringe IV PRN ordered for these patients, because by morning glucose drops. They're not able to eat anything, drink anything. Make sure these patients have their allergy bracelets on. If patients are allergic to codeine, notify the doctor, because these patients are going to be under anesthesia. Let the doctor know. Make sure any allergies of the patient, they're all listed in the patient's chart. Usually for the ladies, the doctors usually order a pregnancy test for certain maybe abdominal surgeries. If it's ordered, make sure the result is in the patient's chart. In the morning, early in the mornings, some surgeries require IV antibiotics, not oral. The patient is NPO. If the doctor orders early morning antibiotics, make sure it's given at the time the doctor wants it to be given. Okay, what do you know about the morning before surgery? What are you supposed to be doing? We're talking about their blood sugar. If there are any early morning lab values, make sure all these are completed before surgery. Some patients may not be having surgery in the morning, early morning. Some may be having it in the afternoon. But if there's any order there for aspirin, Plavix, let the doctor know that the order is still there for you to administer aspirin. Some of these medications are oral, but if they are injection blood thinners, notify the doctor pre-operative, because the patient is going for surgery, is at risk for bleeding. You do not want to administer any blood thinners without the doctor's permission. Okay, the morning before surgery, remove all hairpin, dentures, jewelries, contact lenses, hearing aid. Remove all these from the patient if they're going for surgery. Before surgery, make sure the patient empty their bladders. We do not want any patients should empty their bladders before surgery, especially those patients who are going for abdominal surgery. Doctors may order a Foley catheter to be inserted before surgery. Okay, so that's your answer. Okay, next question. How would you consider cultural and spiritual practices for your patients going to surgery? Correct answer. Some religions, they do not do shaving, so do not shave your patient's hair. Some patients, because of religious practices, Rastafarians, dreadlocks, you cannot shave the head. So consider cultural and spiritual practices of your patients. Jehovah's Witness will not do blood transfusion. If it's a Jehovah's Witness, make sure the doctor understands. Next question. What will be your preoperative teaching for your patients? Correct answer. You'll teach them how to use your Incentive spirometer, that little gadget you use to breathing at the bedside. The Incentive spirometer is used post-operatively to prevent pneumonia, lung expansion. Your patient after surgery isn't going to be getting up out of bed, walking the hallway immediately. So to prevent pneumonia, we'll ask the patients to blow into this little gadget every 10 minutes, 6 times on the hour. We'll teach them to use the Incentive spirometer. We'll teach them about the PCA machine. PCA stands for Patient Controlled Analgesic Pump. Patient Controlled Analgesic Pump. This is a pain pump the patient uses after surgery. They will control their own pain medication. They do not call the nurse for pain medicine. Some patients are concerned about overdosing on these narcotics, morphine, dilaudid, fentanyl. Tell them there is no risk for overdose on a PCA pump. It's completely locked in. It's under lock and key. It's usually witnessed by 2 RNs. It's a narcotics. It's programmed. If the patient is supposed to get 6 doses of pain medicine for the hour, if the patient press the pump 60 times, the patient will only get 6 doses. It is completely controlled. No risk for overdose. So you'll teach them that. You can teach patient and families preoperatively. Make sure when you teach it's open-ended communication. Open-ended communication allows the family and the patient to ask questions. Next question. What do you know about the intraoperative phase? Correct answer. Intraoperative phase begins when the patient enters the surgical area to be transferred to the operating bed, the OR bed. The patients in the intraoperative area will be cared for by the surgeons, the anesthesiologist, the scrub nurse, the circulation nurse. That's your answer. What's the duty of the scrub nurse? Do you know? The correct answer, the scrub nurse do the scrubbing, do the gowning and the gloving for the nurse self, the surgeons, the anesthesiologist. The scrub nurse assists with the gowning and the gloving. Scrub nurse sets up the tools, sterile feel, donning sterile masks and gloves for surgical team, passing surgical instruments to the surgical team. That's your correct answer. Do you know what's the correct way to do a surgical hand washing? The correct answer, finger and hands should be scrubbed first with progression of forearms and elbows. Hands should be held away from surgical attire higher. Helps to prevent contamination. My next question, what are the responsibilities of your circulation nurse? Your circulation nurse works as your patient's advocate, ensures procedure have patient's interest, and is in the hands of the circulating nurse. The circulating nurse performs duties outside of the sterile field. There's another question about what happens. There's another question here about the responsibilities of the intraoperative nurse, and here is the answer. The intraoperative nurse assists with positioning the patient, prepping the skin for incision, coordinate the patient's care before surgery, during surgery, provide emotional support for patients and family, provides safety, provides dignity. The intraoperative nurse continues assessment for patient throughout the intraoperative phase. The intraoperative nurse initiates time out. Make sure you know time out. What is time out? Correct answer. Initiates timeouts between entire surgical team before surgery to verify correct procedure, correct patient by checking the ID bracelet, and the correct site. Very important. The intraoperative nurse provides warm blankets after surgery. Patients are covered with very warm blanket coming out of a warmer, because after patients comes out of surgery, they are very cold. They will be shivering. So the intraoperative nurse loads them with a lot of hot blankets. Okay, hit the thumbs up for me. Please subscribe. Please introduce others to my channel. Stay blessed I have preoperative nursing part 2 coming up shortly, and part 3. Thanks for watching. Have a good day.